And a good Tuesday morning to you, 100.9 FM, 13 WMVO, WMVO.com's AM Knox County program. Thanks for joining us here today. We're going to have Mayor Matt Starr in studio in the second half of our program today. So get ready for that, as he will be in studio, and you can call and ask questions. And, of course, we've got a list of things to go over, too. But if we don't get to all of them because you're calling in and asking questions, that's okay as well. And Dr. Jim Jenkins with us from Swetlic Chiropractic and Rehabilitation in studio. It's great to have him back in here. I know Dr. Jenkins was on the phone the last time he was on with us, but we're back at it and back in studio, so we look forward to chatting with him here. We do want to thank Tim Horton's Coffee and Bake Shop, Coshocton Avenue in Mount Vernon. It is always fresh. You can stop by Tim Horton's, try their donuts, croissants, their sandwiches. I know I talk about a bunch of unhealthy food here, Dr. Jenkins, and then we're going to talk about health here, but yeah, you got to treat yourself sometimes at Tim Horton's. Dr. Jim Jenkins, we were kind of shooting the breeze there before the show started, a former official and now working at Dr. Swetlic Chiropractic and Rehabilitation. So tell us about how you got over here into Mount Vernon and your time, your 2 years that you almost had there.
Well, I've always, and first of all, thank you for having me back in the studio, Tyler. Always appreciate talking with you and enjoying your company just in chatting about a variety of things. But I've had the pleasure of working in the Central Ohio area for many years since the late 70s, and in fact often would come up to this area to not only work high school basketball games, but also lacrosse games out at Kenyon and an occasional basketball game. So this area has always been a comfort zone for me as I've traveled around and done things in education and health. And I was lucky enough to meet Dr. Jim Swetlic and the team about a couple of years ago, and we actually worked the way that I could actually be quite a regular up in the Knox County, and just a very short commute for me from the just south of the Centerburg area. So it's actually been just a wonderful ride, and we're doing some great things. I love being here.
All right. Well, Centerburg's a tremendous area. There's a lot of really cool people that live there. I live there, and it's a great area anyway. But in terms of let's talk a little bit about Swetlic Chiropractic and Rehabilitation a little bit, and some of the things you do. You're a doctor of physical therapy at Swetlic Chiropractic and Rehabilitation. We talk about kind of two separate parts of this. You've got the chiropractic side and you got the physical therapy side, but they sometimes can merge, can't they?
Well, they certainly do. And the beautiful thing about the way we practice is that it is a team effort, and it's a team effort with Dr. Jim Swetlic and Dr. Jake Overholt, so that they will do adjustments or do referrals of patients to physical therapy, and of course vice versa, where if I have some challenges with patients actually having some alignment problems where there is a ligament adjustment, a bone adjustment, a joint adjustment, where they can reduce pain. Because once a patient is in distracting pain where they have difficulty focusing on their ability to move and their body has to make compensations, then finding a way to get that patient back to a level where they can concentrate on what they do, or at least not distracted by that pain level, is something that we work at as a team.
Yeah. And, one of the things that I always talk about with Dr. Swetlic is that there's some people that they just sit and they are in pain for a long time and they don't go get the help. And, the sooner you feel the pain and you go get help, it's easier for you guys, too, on your end.
It certainly is, because once you get into pain, it actually drives you towards, okay, I have to find a way to do what I need to do and reduce my pain. What does that lead to? It usually leads to compensation, where you walk in a very odd pattern. You actually change your posture. And worse than that, we typically will not do some of the things that we normally would get done because, I actually can't walk to the back of that large box store, so I'll have to do some shopping at a smaller shop, or maybe I won't shop at all. You may not do things with your family members. So once you start to adjust your life and downgrade your activities, you start to feel sicker because you are less functional and you're doing community activities on a much less frequent level.
Let's talk about components of health, though, and being able to get healthy. Dr. Jenkins, what are some of the big components of health?
Well, we really focus on 5 areas, and it's not for everybody that they have a deficit in these areas. So we work on flexibility, or at least these are the things we assess. We look at flexibility, strength of the patient, their balance, their cardiorespiratory function, and, of course, we document their pain. We don't want them to ignore pain because we like to think of pain as almost being that warning light on the dashboard of your car. If you actually take the bulb out of your engine warning light in your vehicle, you will not know, or you may not be aware that something is significantly wrong. So we don't have patients, ignore their pain. We want them to acknowledge it, how it changes, the quality of it, and then we try to reduce it. But of those 5 components, the flexibility, the strength, the balance, the cardiorespiratory fitness, and the pain level, we tend to focus on producing some balance in that patient.
And we talked about the fact that there are some patients that maybe just need physical therapy, or there are some that need just the chiropractic side of care. And there are some that need both. And so it just really depends on the patient and their situation, Dr. Jenkins.
That's so true. And that's where we tend to focus on not just a physical parameter of balance. We look at what the patient is going to benefit from in terms of what type of treatment they would benefit from, but also what type of treatment they are willing to undergo. Just because I feel as a clinical professional that patient actually would benefit from working on their gait mobility and their strength and their ability to stand on one leg, because walking upstairs and taking one step, 1 foot in front of the other is a matter of balance. This may not be something that is important to the patient. They may not have the time for it. So it's a negotiation. It's a matter of what the patient is willing to work at and what they are going to achieve, and reassessing those goals, and also reassessing the patient's commitment to those activities.
Yeah. Well, obviously, and again, Dr. Jenkins, Jim Jenkins is with us with Swetlic Chiropractic Rehabilitation. We went through this pandemic and everything, and I know at a time you guys were kind of limited and things like that. But doing things beyond just when they're getting treatment from you, but going home and doing the same things, and not going home and going, I'm going to just do the opposite of what I just did, because it just reverses all the work you just put in, right?
Well, that's true, but we know that some patients are just not exercise-oriented. I can come up with an exercise program that I just think is wonderful and should address that patient's needs and deficits, and I print out that program, walk them through the program so that they can perform it really without question and hopefully to recall. But if the patient is not an exerciser, they may just decide, I don't have time in my life. I cannot balance my schedule so that I can get that in. So primary to what I do with many patients is to find things that they can do during the course of the day, whether they're sitting at a desk and working on a computer, whether they're actually shopping. They can actually do simple movements where they can actually shift their hips. They can hold on to the shopping cart, practice standing on one leg, using the right biomechanics and the right alignment that hopefully they have gained from looking at themselves in the mirror. And it's actually a wonderful thing to get some of that visual feedback. And if it's exercise that they can accomplish without setting aside a separate time from their busy schedules, it's usually something that they will get done.
Yeah. Dr. Jim Jenkins is with us, and we thank him for joining us from Swetlic Chiropractic and Rehabilitation here on AM Knox County on a Tuesday. It's the third Tuesday of the month, and that's when they are always on with us, Dr. Swetlic or Dr. Jenkins or Dr. Overholt, and this obviously today is Dr. Jenkins. But we're going to be talking some more with Dr. Jim Jenkins here on the program. We're going to take this quick break, though, and be back. More AM Knox County coming up. Welcome back. It is AM Knox County here on this Tuesday. Thanks for joining us. Don't forget that Mount Vernon Mayor Matt Starr will be joining us on the second half of our program today. He'll be in studio. You can call and ask questions. We've got some things we're going to be talking about as well, but of course we'll be doing that. And hey, I want to wish Darian Kelly a happy birthday today, as it is his birthday, and had to give a shout out to him today on number 35. Happy birthday, Darian. All right, Dr. Jim Jenkins is with us here, and we appreciate him joining us from just down the road here. You know, we've kind of been talking about, you know, when you can get the treatment, then you got to go home, and you got to kind of work on it as well. And same thing of what you put in your body. I mean, I always try to say it's kind of like almost like a maintenance with a car. You know, you're going to have to change the tires some. You're going to have to change the oil. You're going to have to put gas in it. But it's what type of gas you put in it, you know, what kind of tires you're getting, what kind of oil you're getting, that can make a difference on how long your car runs. It's almost the same thing with your body. You got to put the right things in there, Dr. Jenkins.
It certainly is. But I like to think of nutrition in a somewhat more relaxed fashion than some other clinicians do. I think it's critical that we actually eat a balanced diet so that you're actually, you know, getting some of those nutritional components in and going across food groups. But I think it's also important that we be, you know, honest and fair with ourselves and actually not take ourselves into a state of denial or avoiding food types that really give us some joy. Eating those things in moderation, whether they, you know, be those occasional sweets. It's like, yeah, you can have a half a muffin, but you don't have to eat the whole six-pack. So, you know, just being able to back off, but not going into a full denial piece where you get anxious and actually increase your stress and cortisol levels in your body, those stress hormones that actually work very hard against you staying as healthy as you could. That adrenaline flow actually can inspire some of the hormonal systems to actually drive the deposition of fat so that you gain weight. We typically gain weight when we're stressed, and then we tend to go off of our good eating habits when we get stressed. And one of those stressors, again, can be denial. So, again, as we talked about in the previous segment, having some balance in your life where you can make good choices, but you actually don't feel a prisoner to those choices is important.
Yeah, you know, I'm a stressed guy myself, but thankfully I haven't eaten my whole house or anything like that. But, you know, we've talked about that when you come to Swetlic Chiropractic and Rehabilitation, whether you're doing the physical therapy side, which you handle, and then the chiropractic side, what Dr. Swetlic handles and Dr. Overholt handles as well, is that, you know, they can tell you all these things to do and do all these different things, but if you end up going home and you stuff your face full of sweets, like you mentioned, and you eat 2 whole pizzas or something like that, you're really making it difficult on your body and on your bones, and making it where really the work that you put in is almost irrelevant.
And it's been, you know, said by people much wiser than myself that you can't outwork poor nutrition. You can actually, you know, do all the exercises that are recommended for strength and balance and flexibility. But if you ingest too many calories or actually, you know, put too many impurities in your body, it's actually hard to keep yourself at a reasonable fitness level. So, yes, eating those things and as much as anything, trying to get the appropriate amount of hydration in your body is critical. And I like to think of hydration not in just the water that you drink, but how much fluid do you actually have in the foods that you consume? If you eat a raisin rather than eat a grape, not only does it take longer to eat the grape, but you actually are getting some of that fluid content. So trying to get that significant amount of fluids into your body can actually help you feel like you are fuller, faster and then actually kind of cut off your desire to keep stuffing food into our mouths. We actually send a signal to our body, and we do our body a wonderful service by keeping it fully hydrated.
Yeah, well, I remember when I was in high school, many years ago, Dr. Jenkins, it was probably, 40 years ago. No, I'm only 30. But when I was in high school, I remember walking through school, and I remember there was a sign up somewhere, and it said that you have to actually walk the length of a football field to burn off one M&M. I remember seeing this sign, and after that point, I'm like, oh, geez, I'd have to walk a football field a lot every time I eat M&Ms and things. But when it comes down to it, you kind of alluded to it at the beginning, too, where as you get older, your metabolism does slow down, and you already have kind of a degeneration of muscles and bones and stuff like that, and that's where it really becomes crucial that you are watching what you're eating and what you're refueling your body with.
And it becomes so important because as we get older, as you mentioned, we actually will lose some bone density. We have less muscle, but we sometimes have more body weight. And it actually just takes, more muscle strength, and it's more difficult to balance a heavy load. And even if that load is a relatively healthy load, if you just think about the weight of your head, which is typically 12 to 15 pounds, just carrying that around, but carrying it around in an orientation where your head is well forward or your head is actually bent to the side because your body's compensating to some pain, carrying that extra weight in the wrong position can actually lead to an overload into injury. And that same principle applies to a little extra weight at our waist or at our hips that is actually not supporting movement, but something that we have to carry around, just like, an overload in a rucksack that we are doomed to kind of throw over our shoulders and tote up and down stairs and across that parking lot and do our shopping.
So let's talk a little bit about if somebody is out there listening right now, maybe they've been in pain for a while and they need help as the chiropractic side or the physical therapy side of Swetlic Chiropractic and Rehabilitation. What is the best way to get in touch? Do you guys need to do like an initial physical exam on them? How do things go there?
Yeah, we will set you up. Well, the first thing is to actually, if you're coming in for physical therapy, to actually get a prescription from your primary care physician. And you can bring in that script so that your insurance will actually, recognize and actually have the insurance, take care of any charges or most charges minus copays for that treatment. But calling to chiropractic at Swetlic Chiropractic at 740-392-1407 and setting up with an appointment. And when you come in for that appointment, we will take you through a physical therapy initial evaluation, and we ask you to reveal to us through a questioning process and a physical assessment what your abilities are, what you want to get to, and what is keeping you from getting there. And even if you haven't figured that out, it is our process where you as a patient actually get to lead your own therapy. You know what you cannot do. You have a feeling that, okay, this is what I want to accomplish. My job is to figure out and to help motivate and inspire you to get to the goals that you set forth for yourself. And as we start to work towards those, we just adjust how hard we work at it and how we're accomplishing those goals until we actually get to a place where you're satisfied with your function.
Yeah. So get in contact with Swetlic Chiropractic and Rehabilitation, Dr. Jim Jenkins, who is in with us today. Also, Dr. Oberholt and Dr. Swetlic, of course, options too. So, Dr. Jim Jenkins, thank you so much for your time here today. It's great to catch up with you once again. It's great to have you in studio, too, because we didn't get to have you before.
It's good to see your face and actually be in the home studio. I appreciate it.
Well, Dr. Jim Jenkins, he'll be back with us at some point again, probably in 2021, if I'm doing my math here right. So we appreciate him joining us. And we do want to thank Tim Hortons Coffee and Bake Shop, Coshocton Avenue in Mount Vernon. It is always fresh. fresh. You know, we talk about all this healthy stuff, but they probably have some healthy options too. So, but Tim Hortons is fantastic. You stop by them. They got the drive-through as well. We're going to take this break. We'll come back, and more of AM Knox County is coming up.